Gallbladder drainage is necessary for patients with acute cholestasis who are unsuitable for surgery. Endoscopic transpapillary gallbladder drainage (ETGBD) is beneficial for patients with coagulopathy and enhances their quality of life due to internal drainage. However, guidewire insertion into the gallbladder through the cystic duct is challenging, as identifying the entrance to the cystic duct is often difficult. To address this, cholangioscopy-guided guidewire insertion is helpful. Recently, it was reported that a novel thin cholangioscope with a length and diameter of 219 cm and 9 French enables per-oral cholangioscopy (POCS) guided procedures using a balloon endoscope with a 3.2 mm forceps channel. We report a case of Roux-en-Y gastrectomy in which POCS-guided guidewire insertion into the gallbladder was successfully performed using a novel thin cholangioscope under balloon endoscopy. A 73-year-old man who underwent Roux-en-Y gastrectomy and presented acute cholestasis was referred to us. CT revealed an enlarged gallbladder with wall thickening, indicating acute cholestasis. Since the patient was unsuitable for surgery and had coagulopathy, ETGBD was attempted using a short-type single balloon endoscope with a working length of 152 cm and a working channel of 3.2 mm diameter. Although fluoroscopy-guided guidewire insertion into the gallbladder was attempted, it was unsuccessful. Subsequently, POCS was performed using a thin cholangioscope. A thin cholangioscope was inserted. The entrance to the cystic duct was identified. POCS-guided guidewire insertion into the gallbladder was attempted. POCS-guided guidewire insertion into the gallbladder was successful. Finally, ETGBD was completed using a 7 French plastic stent. There were no adverse events occurred, and the cholestasis resolved after stent placement. The stent has been in place for 5 months so far, and we do not plan to exchange it due to the patient's poor general condition, unless cholestasis recurs. His clinical course has been favorable so far. This novel thin cholangioscope can be very helpful and improve the success rate of ETGBD in patients with Roux-en-Y gastrectomy.